Welcome to the Healthy Pantry, your daily dose of nutritional knowledge and wellness inspiration. We are delighted to have you here. In today's video, we're diving deep into the magnificent world of hyperthyroidism. Hyperthyroidism is a condition where the thyroid gland becomes overactive, producing an excess of thyroid hormones. This small, butterfly-shaped gland located in your neck plays a crucial role in regulating metabolism and energy levels throughout your body. When it becomes overactive, it can lead to a range of symptoms and health issues. But fear not. We're here to guide you through everything you need to know about hyperthyroidism, from its causes and symptoms to diagnosis and treatment options. So sit back, relax, and let's explore this fascinating topic together. First and foremost, let's have a closer look at what causes hyperthyroidism. Hyperthyroidism can arise from various underlying causes, each affecting the thyroid gland's function differently. Graves' disease. This is the most common cause of hyperthyroidism and occurs due to an autoimmune disorder. In Graves' disease, the body produces antibodies that stimulate the thyroid gland to produce excessive amounts of thyroid hormones. It's often associated with other autoimmune conditions and can have a genetic predisposition. Thyroid nodules. Sometimes, abnormal growths or nodules develop on the thyroid gland. These nodules can become overactive and produce thyroid hormones independently of the body's normal regulatory mechanisms. This condition is known as toxic nodular or multinodular goiter. Thyroiditis. Inflammation of the thyroid gland, known as thyroiditis, can lead to a temporary period of hyperthyroidism. There are several types of thyroiditis, including Hashimoto's thyroiditis, an autoimmune condition, subacute thyroiditis, often caused by a viral infection, and postpartum thyroiditis, which occurs after childbirth. Excessive iodine intake. While iodine is necessary for the production of thyroid hormones, excessive intake can sometimes lead to hyperthyroidism, particularly in susceptible individuals. This can occur through dietary supplements, certain medications, or contrast agents used in medical imaging tests. Thyroid medications. Certain medications, such as amiodarone, used to treat heart rhythm disorders, and lithium, used to treat bipolar disorder, can interfere with thyroid function and potentially lead to hyperthyroidism. Pituitary tumors. In rare cases, tumors of the pituitary gland, located at the base of the brain, can produce excess thyroid-stimulating hormone, TSH, leading to increased thyroid hormone production by the thyroid gland. Overactive thyroid gland from unknown causes. In some instances, hyperthyroidism may occur without an identifiable underlying cause. This condition is referred to as idiopathic or primary hyperthyroidism. What's more, hyperthyroidism can manifest through a variety of symptoms, and the severity and combination of symptoms can vary from person to person. Let's expand on each symptom associated with hyperthyroidism. Hyperthyroidism often leads to unexplained weight loss despite increased appetite. This occurs because elevated thyroid hormone levels boost the body's metabolic rate, causing it to burn calories at a faster pace than usual. As a result, individuals may find themselves losing weight without making any changes to their diet or exercise routine. This weight loss can be particularly concerning if it occurs rapidly or if the individual is already at a healthy weight. In addition to physical changes, unintentional weight loss can also impact a person's emotional well-being, leading to feelings of frustration or concern about their health. Additionally, one of the hallmark symptoms of hyperthyroidism is palpitations, which refer to an abnormal awareness of the heartbeat. The excess thyroid hormones circulating in the bloodstream can stimulate the heart to beat faster and more forcefully than normal, leading to palpitations. This sensation may feel like a fluttering or pounding in the chest and can be accompanied by feelings of anxiety or discomfort. Palpitations can vary in intensity and duration, occurring sporadically or persistently throughout the day. While palpitations themselves are not usually harmful, they can be distressing and may warrant medical evaluation to rule out any underlying heart conditions. Moreover, hyperthyroidism often causes excessive sweating and an intolerance to heat. This occurs because thyroid hormones play a key role in regulating the body's temperature and sweating response. When thyroid hormone levels are elevated, the body's thermoregulatory mechanisms become overactive, leading to increased sweat production and a heightened sensitivity to warm environments. As a result, individuals with hyperthyroidism may find themselves sweating profusely even in mild or moderate temperatures, and they may struggle to cool down effectively. This can be particularly uncomfortable and inconvenient, impacting daily activities and quality of life. Furthermore, fine tremors, especially noticeable in the hands, are a common symptom of hyperthyroidism. These tremors occur due to the stimulatory effects of thyroid hormones on the nervous system, causing involuntary muscle contractions and rhythmic shaking movements. The tremors may vary in severity and frequency, ranging from subtle vibrations to more pronounced shaking. While tremors in the hands are often mild and transient, they can be bothersome and interfere with fine motor tasks such as writing, typing, or holding objects steady. In some cases, individuals may also experience tremors in other parts of the body, such as the legs or voice. What's more, hyperthyroidism can have a significant impact on mood and emotional well-being, leading to feelings of nervousness, anxiety, or irritability. The excess thyroid hormones circulating in the bloodstream can overstimulate the nervous system, causing heightened arousal and emotional reactivity. As a result, individuals with hyperthyroidism may feel constantly on edge, tense, or agitated, even in situations that would not normally provoke such strong reactions. These emotional symptoms can be challenging to cope with and may contribute to difficulties in interpersonal relationships, work performance, and overall quality of life. It's essential for individuals experiencing significant anxiety or irritability to seek support from healthcare professionals who can provide guidance and appropriate treatment interventions. But wait, there is more. While hyperthyroidism is often associated with increased energy levels and restlessness, some individuals may paradoxically experience fatigue or weakness. This occurs because the body's heightened metabolic state can place excessive demands on energy resources, leading to feelings of exhaustion or depletion. Disrupted sleep patterns, anxiety, and muscle wasting may contribute to feelings of fatigue and weakness in individuals with hyperthyroidism. Despite feeling physically tired, individuals may find it difficult to relax or rest due to the persistent symptoms of hyperthyroidism. Fatigue and weakness can have a significant impact on daily functioning and quality of life, making it important for individuals to prioritize self-care and seek appropriate medical management. What's more, hyperthyroidism can interfere with sleep, causing insomnia or restless sleep patterns. The overstimulation of the nervous system by excess thyroid hormones can disrupt the body's natural sleep-wake cycle, making it difficult to fall asleep or stay asleep throughout the night. Individuals with hyperthyroidism may experience racing thoughts, restlessness, or anxiety that prevent them from achieving restful sleep. As a result, they may wake up feeling unrefreshed and fatigued, despite spending sufficient time in bed. Chronic sleep disturbances can exacerbate other symptoms of hyperthyroidism and negatively impact overall health and well-being. It's important for individuals experiencing sleep difficulties to discuss their symptoms with a healthcare professional who can provide guidance on managing sleep disturbances and optimizing sleep quality. Did you know hyperthyroidism can affect gastrointestinal function, leading to changes in bowel habits such as increased bowel movements or diarrhea? The accelerated metabolic rate caused by excess thyroid hormones can speed up digestive processes, resulting in more frequent and urgent bowel movements. It's important for individuals experiencing gastrointestinal symptoms to stay hydrated and consume a balanced diet rich in fiber to support digestive health. In some cases, medications or dietary modifications may be recommended to alleviate symptoms and regulate bowel function. Hyperthyroidism can also affect the skin's appearance and texture, leading to thinning of the skin. The excess thyroid hormones circulating in the bloodstream can impair the skin's ability to retain moisture and regenerate cells, resulting in a thinner and more fragile skin barrier. Individuals with hyperthyroidism may notice that their skin feels more delicate and prone to irritation, dryness, or injury. They may also be more susceptible to developing bruises, cuts, or abrasions due to the skin's reduced resilience. Thinning of the skin can be particularly concerning for older adults, as it increases the risk of skin damage and delayed wound healing. Maintaining good skincare habits, such as using moisturizers and protecting the skin from excessive sun exposure, can help support skin health in individuals with hyperthyroidism. If you find this video helpful and informative, please support the Healthy Pantry channel by leaving your comment below, liking this video, and subscribing for more daily health and nutrition tips. Changes in hair texture are common in individuals with hyperthyroidism, with many experiencing fine, brittle hair that lacks luster and volume. The excess thyroid hormone circulating in the bloodstream can disrupt the normal hair growth cycle, leading to changes in hair texture, thickness, and appearance. Hair may become dry, fragile, and more prone to breakage, resulting in noticeable thinning or loss of hair density. Individuals may also notice increased shedding of hair during brushing or washing. While changes in hair texture can be distressing and affect self-esteem, they are usually reversible with appropriate management of hyperthyroidism. Maintaining a healthy diet rich in essential nutrients and using gentle hair care products can help support hair growth and minimize damage. And last symptom, some individuals with hyperthyroidism may develop an enlarged thyroid gland, known as a goiter. The excess stimulation of the thyroid gland by thyroid-stimulating antibodies or other factors can cause it to grow in size, resulting in a visible swelling in the neck. A goiter may feel like a firm or rubbery mass when palpated, and individuals may experience discomfort or pressure in the neck area due to the enlarged gland pressing against nearby structures. In some cases, the goiter may be accompanied by symptoms such as difficulty swallowing, dysphagia, hoarseness, or a sensation of choking. Regardless of size, a goiter should be evaluated by a healthcare professional to determine its underlying cause and ensure appropriate management and treatment. Now let's delve deeper into the diagnosis of hyperthyroidism. The healthcare provider will begin by taking a detailed medical history, including symptoms, family history of thyroid disorders, medication use, and any relevant past medical conditions. A thorough physical examination will also be conducted to assess for signs of hyperthyroidism, such as an enlarged thyroid gland, goiter, rapid heartbeat, tremors, or changes in skin and hair texture. Blood tests are essential for assessing thyroid function and confirming a diagnosis of hyperthyroidism. The primary thyroid function tests measure levels of thyroid hormones and thyroid-stimulating hormone, TSH, in the bloodstream. Elevated levels of free thyroxine, T4, and triiodothyronine, T3, along with low or undetectable levels of TSH, are consistent with hyperthyroidism. Additional tests, such as thyroid antibody tests, may be performed to determine the underlying cause of hyperthyroidism, such as Graves' disease or thyroiditis. In some cases, imaging studies may be ordered to evaluate the structure and function of the thyroid gland. Thyroid ultrasound is a non-invasive imaging test that uses sound waves to create images of the thyroid gland, helping to assess for abnormalities such as nodules or enlargement. Thyroid scan, using radioactive iodine or technetium, can provide information about thyroid gland function and detect areas of increased or decreased activity. This test measures the thyroid's ability to take up radioactive iodine, which is essential for producing thyroid hormones. By administering a small amount of radioactive iodine orally or intravenously, healthcare providers can assess the thyroid's uptake of iodine and determine its activity level. Higher than normal uptake indicates increased thyroid function, consistent with hyperthyroidism. If thyroid nodules are present and there is concern about the possibility of thyroid cancer, a fine needle aspiration biopsy may be performed. During this procedure, a thin needle is inserted into the nodule to collect a sample of cells for analysis under a microscope. FNA biopsy helps differentiate between benign and malignant thyroid nodules, guiding further management decisions. In cases of Graves' disease, which is the most common cause of hyperthyroidism, healthcare providers may also assess for signs of Graves' ophthalmopathy, an autoimmune condition affecting the eyes. Symptoms may include eye pain, redness, swelling, or protrusion, exophthalmos. An ophthalmologic examination may be recommended to evaluate eye health and determine the extent of ocular involvement. Treatment for hyperthyroidism aims to normalize thyroid hormone levels, alleviate symptoms, and address the underlying cause of the condition. The choice of treatment depends on factors such as the severity of symptoms, the underlying cause of hyperthyroidism, the individual's age, overall health, and personal preferences. Treatment options include, first, antithyroid medications. These medications, such as methimazole or propylthiouracil, work by reducing the production of thyroid hormones. Second, radioactive iodine therapy. Radioactive iodine is taken orally, and it concentrates in the thyroid gland, where it destroys thyroid tissue, thereby reducing hormone production. Third, thyroid surgery, thyroidectomy in some cases, surgical removal of part or all of the thyroid gland may be necessary, especially if other treatments are not effective or if there's concern about thyroid nodules. Fourth, beta blockers. These medications may be prescribed to help manage symptoms like rapid heartbeat and tremors while other treatments take effect. Overall, prompt diagnosis and appropriate management of hyperthyroidism are crucial for preventing complications, minimizing risks, and optimizing health outcomes for individuals affected by this condition. Regular monitoring and follow-up with healthcare providers are essential to address any potential complications and ensure comprehensive care. And there you have it, folks. We hope this video has provided you with a better understanding of hyperthyroidism and its potential impacts on your health. Remember, if you suspect you may have symptoms of hyperthyroidism or have been diagnosed with the condition, don't hesitate to reach out to your healthcare provider for guidance and support. With proper diagnosis, treatment, and management, you can take control of your thyroid health and live a happy, healthy life. Stay informed, stay proactive, and take care of yourself. See you tomorrow in the next video. Thank you for joining us here at the Healthy Pantry. We hope you found the information valuable and inspiring. Remember, your health is a journey, and we are here to guide you every step of the way. Thank you for watching, and we will see you in the next video.